I understand why you're so afraid of filler because we see people walking the streets of our city. We see people in our personal and professional life, celebrities in tabloids who are examples of bad filler. But the reason those are the faces you think of when you think of filler is because they've had bad filler. There are people you are seeing in whatever capacity who you think look amazing for their age, younger than their age, but appropriately younger than their age, right? That aren't being candid about what they have done. And one of those things is filler. But you never think about their face when you think of filler because their filler's done well, right? And I think that really changes the framework or like the mindset for my patients. And then patients are very understanding of that concept.
Hi, Skin Friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have my colleague, board-certified dermatologist, Dr. Rachel Westbay, joining me. She is a cosmetic dermatologist practicing on the Upper East Side of Manhattan. And today, we are going to be discussing fillers because I feel like fillers have gotten a ton of bad press recently. And a little bit deservedly, I would say. We've seen some really bad HA filler out there, hyaluronic acid filler, but it also can do amazing things. And it's something that I am frequently having to explain to my patients and reassure them that it can be done safely, it can be done naturally. So today we are taking a deep dive into fillers, especially hyaluronic acid fillers, the good, the bad, the ugly, and how to make sure you are getting the best results from your injectables. If you are thinking about getting a hyaluronic acid filler, you definitely want to check this out. Dr. Westbay, thank you so much for joining me. I'm so excited to talk about fillers today because not a day goes by that I don't have a patient look at me with like shock eyes when I say, oh, yeah, maybe we should do some fillers because I feel like it's gotten this crazy reputation now.
100%. It's so funny. I always say that 2024 was the year of bashing filler. And it is such a drag to those of us who know how to use it appropriately, who find that a lot of times nothing else can achieve what filler can achieve. And I tell my patients, I'm so accustomed to having people be like, I'm game, I'm game, I'm game, I'm game. And then the minute I mention filler, people get deer in the headlights eyes and they freak out. So I have to kind of like pull them off the ledge and explain why, when done well, fillers can be so fantastic, which is why I wanted this to be my topic today, honestly.
I mean, it literally happened to me today. I was talking to someone about my age and hadn't really done anything yet or had some filler, but was worried about looking overdone. So, first of all, let's just say, what are fillers, right? Like the fillers that we're talking about.
So fillers, I think generally speaking, if you're going to make an umbrella definition of them, are essentially injectable substances that help with any variety of cosmetic concerns that can range from volume loss to softening fine lines and, various other really purposes as well. The conventional fillers most people talk about are what we call hyaluronic acid fillers. So hyaluronic acid fillers, which we can go more into, I'm sure, are more of like your immediate volumizing or softening fillers that have to be redone within a certain period of time. And then you have your biostimulatory fillers, which I think the public on the whole tends to be less familiar with, but those who are cosmetically literate are, which are your Sculptras and your Radiesses of the world, which are not made of hyaluronic acid, but rather different substances that help build your own tissue over time. But long story short, no matter which way you cut it, they're essentially injectable substances, no matter what the substance is, that help to volumize and or soften fine lines and help with the contours of the face.
Yeah, absolutely. And we can say brand names here, like it's not sponsored. So, like the hyaluronic acid fillers, we tend to be talking about like your Restylans, your Juvederms. Yeah, those are like the big ones. Of course, within those families, there's tons of different names too. But why was 2024 the year of like filler hatred or hyaluronic acid filler hatred? What's going on with that?
Yeah, I think it's a combination of things. I mean, I think to be honest with you, and I know you see this as a dermatologist too, the rise and popularity of cosmetic procedures continues to soar with every passing year. And unfortunately, that means that everybody wants to dip their toes in offering that service to people. So we see more and more med spas popping up, not to say that there are not people who are totally proficient and capable at those places, but we're seeing more and more specialists who are not trained in core aesthetic specialties doing these procedures. So all of this to say that I think technique and skill level and degree of education really matters here. And I know I'm on my soapbox and you are probably on the same one as a dermatologist, but that really matters. Secondarily, I think people often are starting too young and providers are not turning people away when the patient is not an appropriate candidate, owing to wanting to make a buck, unfortunately, in many cases. And I think people are coming in for touch ups too frequently, and that's giving you that overfilled face that has been so feared, or that balloon face because fillers being put upon filler layer, like a layered cake, right before the filler allows to go to be dissolved appropriately by the body. But the other thing that I found I have to fight are these myths that have been blown out of proportion with media like TikTok and what have you. Like these studies that came out saying that filler lasts a little bit longer than our initial studies showed, right? But unfortunately, somehow this has been misconstrued as filler stays in your face forever. And that's not what happens, Like if you really look at the data, sure, microparticles of hyaluronic acid stay in the face maybe a little bit longer than our initial studies suggested. But those are not clinically significant volumes of hyaluronic acid. Those are not volumes that are being seen in the face when you look at the patient. And it actually goes to show, or it's shown that it actually stimulates collagen doing repeated hyaluronic acid fillers. So those microparticles actually may be doing you a service, but because of these things being taken out of context, people think that it's like concrete that stays in your face forever. And I find that I have to fight that myth a lot. And then the secondary one, which I'm sure you do also fight, is migration. That was like a topic of 2024, right? Like filler just migrates in this vacant cavity in your face.
Or like you put it in your lip and next thing you know, it's under your eyes.
Totally. And I tell this to patients all the time. And you know what? I have to step back and recognize they did not have a medical school education. They do not have the understanding of anatomy. So I get running away with this concept and not really being able to put it into logic or use logic to understand it. But like, yes, your filler doesn't migrate from your lip to your temple. Your filler doesn't migrate from your temple to your nose. It doesn't work that way. So I explain to patients there are ligaments, there are cavities, there are fat plaids, there are all of these things in your face. So when migration happens, we're talking millimeters away from the vicinity in which the filler was initially placed. And I always tell people that I don't know about you, but there's really only two places I've seen migration. And I think the times I see true migration is really, really uncommon. Again, I think because I tend to be seeing my own patients and I know that my technique is appropriate, I really have only seen it in the lip and the tear trough. Those are the only two places I feel like I've ever really seen it. And it makes sense because of the mobility of the lip and because of the lymphatic drainage and the delicate nature of the tissue around the eye, right? But long story short, it's been a ton of myth busting, a ton of things taken out of context, and people who are not injecting appropriately. That's ultimately what it comes down to.
I'm with you, and I'm on that soapbox too, that when done appropriately, filler can look super natural. I do filler on myself, and I usually will give myself as an example. Do I look weird or overdone or blown up, right? And I think people think that how hard can it be? You just put the needle, stick it in the skin, and pump it up. But it's like makeup. Why is it when I do my own makeup, it never looks as good as when a professional makeup artist does it? We're both like sticking on the colors and doing all the right steps, but for whatever reason, their training and their expertise makes a huge difference. Or like baking a cake, right? Like we can use the same ingredients, but someone who really knows how to bake, it comes out better. And so, yeah, I totally agree with you. And people who don't say no, right? They keep doing syringe after syringe after syringe. And that's when you get blown up.
Totally. And the thing I tell my patients, and it's so funny that you use yourself as an example in the room because I do the same thing. I'm like, I hope I'm a good example of like natural looking filler. And I know that I am, right? So I'm happy to be that example for patients. And I do think that that reassures them. So the other thing I tell people in consults is I say, it is not a service to me and my career and my patient base to have you looking crazy. So when people will say yes to syringe after syringe after syringe and not turn a patient away when they are not ready nor need more filler, to me, that's only backfiring on the practitioner, or at least that's the way that I feel. Because although the goal is always for your filler to be so subtle that nobody knows you've had anything done, which is what good filler is, I want to know that if you're having a cocktail out with your girlfriends and you happen to be candid about what you've had done, that if you say, oh, I had filler with Dr. Westbay, someone isn't thinking in their back of their mind, well, mental note, don't go see Dr. Westbay because she looks terrible. Like, I want someone to say, oh, wow, I never would have realized she had something done. So I'm going to go see Dr. Westbay, right? But there's people who just ultimately are only seeing dollar signs and are only trying to pocket as much as they can. And that's part of the problem as well.
No, you're right. My goal for my patients and myself, right, is that no one really knows you had anything done. They just think you look really great. Now, I know there are people who want that overdone, and maybe my aesthetic look is not the same, but I also tell people on this podcast and people I see who say, who should I go see? How do I know if they're good? I would say look at their credentials and training, but also look at the people in the office and look at them. Because if they look kind of overdone, they've got very big lips, chances are that's sort of the aesthetic look they're going for. And you will probably look similar to that as well. So I think that's important too when you're going to a place. What's the look of the people there in the office? Because you're probably going to get that.
I could not agree more. I totally, totally agree. And the other thing that I tell people, which I'm sure you'll agree with, I literally say it in every cosmetic consult to the point that I feel bad for my medical assistants because they have to hear me say the same thing like repeatedly because I do this all day long, right? Is I say, I understand why you're so afraid of filler because we see people walking the streets of our city. We see people in our personal and professional life, celebrities in tabloids who are examples of bad filler. But the reason those are the faces you think of when you think of filler is because they've had bad filler. There are people you are seeing in whatever capacity who you think look amazing for their age, younger than their age, but appropriately younger than their age, right? That aren't being candid about what they have done. And one of those things is filler. But you never think about their face when you think of filler because their filler is done well, right? And I think that really changes the framework or like the mindset for my patients. And then patients are very understanding of that concept.
Absolutely right. We don't see the good filler. We just see a beautiful face. I'd love to know, where are some of your favorite places for filler?
It's really funny, but at least of the last couple years, one of my favorite places is the chin.
Oh, okay.
The chin and actually the lower face. And I'll tell you why. The lower face in general, because I think you will agree, the lower face tends to be a little less forgiving and a little more difficult to treat. Like, I think from a technique perspective, it tends to be challenging because that is where gravity is at its apex. Like, upper gravity is coming to its endpoint, right? So I like doing it because I like excelling at it and knowing that a lot of people cannot, right? So that like jowl or perioral mound that bothers so many women, which for those of you listening and aren't in medicine is essentially that little like kind of sometimes it's fat, sometimes it's skin, little mound that's kind of on the side of where your quote unquote marionette would be, right? But the reason I like chin filler is that I find that the more and more I look at patients from 45 frontward and 90-degree angles, the more I recognize how many people need chin for facial balancing. Maybe it's that they have an enlarged nose, and in order to diminish that and balance their entire profile from all directions, they need chin. Maybe it's that they've lost volume in their chin just over time with age, or they naturally have a recessed or like inward chin, no matter the size of any other feature. But I find that a very small amount of filler in the chin goes such a long way for changing and balancing the proportions of the face. So, like, my staff jokingly call me like Westbay is the chin girl because I love chin.
And this is something men and women get, right?
100%. It's just that you know that a good, again, and this is where it boils down to like who is skilled enough to understand these nuances, right? Like a masculine chin is not a feminine chin, and a masculine cheek is not a feminine cheek, right? Like the apexes, as you know, are different. But I love that. And then I don't think any woman would be able to say they don't enjoy doing a little cheek filler because for me, when it's done well, giving you just that slight little pop, and I always hesitate to say the word pop because I'm not trying to convey that it looks cheeky, right? But giving you that slight little pop or like even shifting the vertex up a little bit so you have a higher cheekbone, I find that my patients have an instant confidence boost and it's that fun contour you can play with your bronzer and your highlighter when you actually are getting a little bit more fun with makeup and you can go out. Do I like lips? Sure. I find that lips really put me in my place a lot. Like I think that I'm good at them, but I think lips are very, very tricky. And even to those of us who are really skilled and considered to be at the top of our class, if you will, as far as cosmetics, I think that lips, even in great hands, can sometimes go really wrong. So I find lips to be quite challenging. So in that regard, it's not that I'm fearful or unwilling to do them, but they're not necessarily my favorite. And I think that a lot of times people want a bigger lip. And then when you actually do it, albeit I agree with you, my aesthetic is also very natural. I find that people freak out when they have a bigger lip. Like you show them the mirror and I try and prepare them for this. And I'll be like, listen, I know this is what you've wanted for X number of years. We're going to do it. But because they're going to swell instantaneously and because the lidocaine and the filler kind of plays with your brain, I'm going to show you the mirror. And even if I've used a third of a syringe, you're going to think they look too big. And no matter how much prefacing I give, I show them the mirror and they freak out. Now, the good news is most of the time they come back and they say you were totally right and I love them and whatever. But because of that, they're one of my lesser favorite places to do because there's so much hand holding involved in lip filler, to be honest.
I have to say about lips, as we age, right? The skin between the end of our nose and our lips, like that, the philtrum elongates. And I find older, my more mature patients they feel like they don't have as much lip show and they want filler. And this is where filler can start looking really weird because then you have a very long upper cutaneous lip and then a full lip. And that doesn't look natural, right? So in those cases, I like to talk about even doing a little lip flip.
I agree with you. I think, and also if you don't choose the right product, it's just adding density and then pulling the lip down further. So I think in a mature patient, sometimes filler can backfire and paradoxically actually worsen that elongated philtrum. I agree with you.
Just it draws attention to it.
Yeah, but it's so funny you were saying that because the whole time you were saying it, I was like, oh, lip flip all the way, 100% lip flip that picture for sure.
Yeah, sometimes like filler, I feel like people are so anti-surgery or they just want the filler, but really they would be better served with something else too. So again, another reason to see one of the core aesthetic professions like dermatologists, right? Who can say, you know what, I could do filler. It's not going to give you the result you want. And it may actually make you look not as normal and more abnormal. So
I find myself doing that a lot with under eye. Like the patients who you see who are so convinced that filler's gonna fix their bag, right? Or filler's gonna fix their tear trough, and maybe they have basically skin to bone with no really supportive tissue. And I just say to them, listen, like you're gonna be better served with maybe laser, maybe activated PRP, something that I can offer. But in all honesty, many times I say you gotta see my oculoplastic surgery colleagues because this might make it worse, right? Like it may you festoons or it may exacerbate festoons that are already there. So yeah, I agree with you 100% for sure.
yeah, let's talk about under eye bags, tear trough filler, right? Because I think sometimes this can be very tricky. And I've seen patients come in from other providers and I'm dissolving it because all of a sudden it gets really puffy and almost has a blue discoloration. So, what are some of the issues with under eye filler?
So the under eye, as I mentioned earlier, is a really finicky area because the tissue is so delicate and there's a lot of lymphatic drainage. That's why I tell patients there's a reason that when you eat ramen or a high sodium diet the night before, or you go a little too heavy on your wine or cocktails, that your under eye is where you carry fluid when you wake up in the morning, right? And then over the course of a day or two or whatever, it'll dissipate. It's because of that lymphatic fluid, which you know well, obviously, as a doctor. So those factors and the contraction of the orbicularis oculi, which is the muscle that's around the eye, we found can make the patient a little more at risk of the filler misbehaving, if you will, over time. And while, yes, I definitely think, and we know that this is more of a risk if the filler is misplaced, as in if it's placed too superficially above the muscle. I have even seen cases from providers that I consider to be very reputable, who I presume have used an appropriate technique where I think to some degree, although in a minority of cases, this is unavoidable and it can just happen over time. But the blue effect is something called the Tyndall effect. So the Tyndall effect is essentially that hyaluronic acid, which is basically a sugar molecule, has a bluish hue. And so when it's too superficially placed, that blue hue is actually seen evident through the skin. And so when filler migrates, which in the tear trough tends to migrate kind of up and up and up and up superficially, whether it's evident right away because it was misplaced to begin with, or it's evident over time because it's migrated, it will have this blue hue and it looks puffy. And I find that when I touch it, I can definitely discern like filler from regular tissue, right? That's where I'm like, thank God we have hyaluronic acid fillers because thank God we have Hylenex. And as much as I tell patients it's infrequent that I have to dissolve filler I've done, I still like the insurance policy, even as the injector, knowing that if someone were unhappy or if something like that happened, that I could dissolve it. And that's the downside to the non-hyaluronic acid fillers, like your non-Juvederms and Restylans and et cetera. Yeah.
I agree. I kind of like you think about lips. I do find under eyes can be tricky and it has to be careful. And this is an area I would really see someone skilled because even as you said, even skilled people, there can be some migration and it can end up looking puffy, more swollen. Also, these hyaluronic acid fillers, as I think a lot of the listeners know, hyaluronic acid helps pull in water, right? Which can be helpful in our skin, but it does cause some swelling. So in the under eye, really you notice any little bit of swelling. So it can actually make the swelling, the puffiness worse. So Well, let's talk about dissolving filler or hyaluronic acid filler, right? So that's one of the nice things about this. What are some of the complications of hyaluronic acid filler where you may want to dissolve it, other than what we talked about in the tear troughs?
Yeah. So, I mean, I would say the more common reason someone dissolves it is just cosmetic dissatisfaction, whether it's immediately or down the road, right? The more feared complications, which is really the reason that those of us, and God forbid, I hope anyone injecting hyaluronic fillers has this in their office, but I've been surprised to hear of people who don't, which is quite terrifying. And the reason we have Hyaluronic or hyaluronidase, as the enzyme is called, is because if it were to get into a blood vessel, which is a major concern, although not a likely one, we want to be able to have reversibility of that instantaneously or near instantaneously, right? Because if it gets into a blood vessel, because it is essentially this gelatinous substance that can block blood flow. You got to think about it like a plumbing system, right? So now it's blocking forward flow of blood. And if it's doing that, it's going to cause death to the skin and tissue that is supplied by that blood vessel. But the earlier a practitioner is able to recognize that, which anyone who's skilled and did adequate training should be able to recognize the early signs of, although sometimes it can be delayed, which is like, I think the thing that makes us lose sleep at night, right? But that's much, and usually that's like venous congestion, not arterial occlusion, right? We want to reach into that fridge, immediately pull up that Hylenex and just start like dousing that area with Hylenex to make sure that we dissolve that bolus that's essentially simulating a clot, if you will, within the vessel. The most feared, I think you would say and agree, complication is basically a piggyback off this concept, right? Which is where you occlude a blood vessel that happens to have what we call an anastomosis, right? Which is a connection with the retinal artery. And that can actually, in exceedingly rare reports, cause blindness. And we know there are certain areas of the face that have a higher risk of that. If you look at studies, it's actually really uncommon in the United States and much more common actually in Asia, where they're doing a lot more glabellar and other areas of injection that happen to be high risk. But anyway, those are the main reasons, really medically rather than cosmetically, that we carry Hylenex.
These risks are real. The blindness, thank God, is not as common, but the necrosis, the skin dying because it's in an artery, that does happen. That happens to people.
Happens to skilled injectors. Like, do I think that if we were to somehow look at a study, and I don't know if said study exists, I'm sure it doesn't, but if we were able to perform a study looking at the incidence of occlusion in these like medical spas relative to board certified dermatologists and plastic surgeons and what have you, I'm sure it would be much, much more likely. But I always say, and Dr. Ellen Marmer, who's my mentor and colleague who I've worked with since I graduated residency, has always told me having a healthy fear of filler should never leave your practice. Like, you should always have a healthy fear of filler. And I think that the day that you stop and you get cavalier and you don't worry about it is the day that you're going to get an occlusion, right? Because to those of us who are top cosmetic dermatologists, we still can have that happen. And I've seen colleagues who've had it happen. And I've had colleagues be out of town who called me who happen to have a practice near where I live who asked me to do the Hylenex because they need to instantly treat the patient and they're like in the Hamptons, right? So healthy fear that's not blow out of proportion the incidence or the likelihood of it happening, but it can happen. And we definitely see it for sure.
And I always say there are complications with everything. And even the best person can have complications. But the difference is, do they know what to do when a complication arises? Case in point, get hyaluronic acid on board, dissolve that, warm compresses, all those things, right? What are some areas that are high risk where the risk of necrosis or occlusion or complications arise?
So I would say that of the more commonly injected areas that I think most are comfortable injecting that are high risk, the temples are one because of the temporal artery running. Although fortunately in the hair in most people, there are anatomic variations where it crosses across the temple. The nasolabial fold, especially at the insertion point near the nose, right? And then there's actually a decent risk on the mandibular angle or like that angle of the jawline. And I think reports are quite less common. The lip can also give you an occlusion. So those are, I think, commonly injected areas where we see occlusion relative to, say, like a cheek. And honestly, everyone always assumes the highest risk is the under eye. And I tell them, interestingly, it's actually not an area I consider to be high risk for blindness nor for occlusion, right? Two areas that a lot of injectors I find will not even inject because the risks are even higher are your glabella, which to those who are, I think everyone listening mostly is medically inclined, but to those who aren't, are essentially those pesky number 11 lines that are between your eyebrows and the nose, like the nose itself performing what we call a liquid rhinoplasty, right? Because the nose has a ton of teeny little, like tiny tributary vessels that can cause an occlusion with a very, very small amount of filler. I do perform both of these areas, but I get a little tachycardic every time I do because, again,
That's right. Healthy fear.
and I will always use a cannula when I do the glabella. In the nose, you could, but I just find that, like, from a technique perspective, I get a better result with, and I find it's better to use a needle, but I am constantly withdrawing, like a good 10-second withdraw, and I know where my, like, even higher risk relative to high risk areas on the nose. But yeah, that's what I would say are your high risk areas. And I don't know if you would agree, if there's anything that I missed.
I love a cannula. But yes, I agree on the nose, small amounts, injecting slowly, and then in between the eyes. I frequently don't need to do it. I try to use other modalities first. But yeah, I mean, sometimes the forehead, do some filler there. But again, there are techniques for people like dermatologists and plastic surgeons who know these techniques to help minimize. We know where the vessels are in general, where they run and how to avoid them. But yeah, certainly if you're going to maybe someone who isn't a board certified dermatologist or plastic surgeon, I would definitely use caution in those areas that you discussed.
Yeah, I had a patient just a few days ago I was doing a liquid rhinoplasty on, and it was the first time in a while that when I pulled back on my syringe, it instantly refluxed with blood. You know what I mean? And thank God I did that, right? Because then I moved into a different position and I knew, but God forbid I hadn't done that. It would have gone potentially right into that blood vessel.
Yeah, and it happens so quickly. So it's important to know that even though they're super common, it's not surgery, there still are real risk with that. So it's important to know. I loved how you mentioned earlier about the chin, that it was about balancing the face. And that's one of the things I love about filler. It's not so much filling in lines necessarily, although it certainly does that, but fillers can be great with facial balancing, which I think is amazing. And I think people underestimate the power of that.
I agree with you. And again, like, I feel like I'm, you know, just beating a dead horse here saying the same thing, but because I say in every cosmetic consult, but I do, right? Because you get accustomed to, like, the things that you say. And one of the things that I do always say is, I'm not looking to change your face, right? I'm not looking for you to not look like you. I'm just trying to balance all of your features in the way that's going to make you look like the best version of yourself, but not a version anyone's going to recognize has had work done, right? So again, like, how can I balance your lips to the width of your jaw? How can I balance your nose to the profile that is also made up of your chin? How do I balance your cheeks relative to your temples, right? Like, you can have these beautiful high projected cheekbones, but if you started to lose volume in your temples, which happens to many of us, if not all of us over time, it can make your cheeks look too overfilled, even though you've never had filler there, right? Because the concavity of the temple is making that disparity of volume in your cheek look too dramatic, right? So yeah, I agree. I don't think people realize that that's really what a good provider is doing, is just balancing your face. They're not someone who's coming and you're just saying, I'm just going to give you bigger cheeks. I'm just going to give you bigger lips. I'm just going to fill in the hollow that's under your eye. Because that's where things look really, really funky, or you start to look simian treating the center face and you like have monkey face, you know?
Oh gosh, yeah. And I feel like it's very piecemeal. Like, oh, I went here for this, and then I went here for that, and there for that. And then it's all just very piecemeal instead of looking at everything in proportion. So I'm glad you brought that up. Now, we had mentioned earlier about different types of filler, things like biostimulants. When and how do you choose between the two?
A couple things. Firstly, for beginners, I always recommend hyaluronic acid fillers personally. Like, even if someone is a good sculpture candidate where they are really gaunt and have lost a ton of volume, which I tend to see a lot in my, like, older, naturally petite women who then lose natural fat in their face. I still, with rare exception, kind of recommend hyaluronic as a way to dip your toes in the pool because, again, reversibility exists. So, like, try it if you like it and you know you want a longer term result that's a little bit more gradual and delayed gratification. Well, then we can transition you to biostimulatory fillers. That's my approach,
And it's immediate, right? The HA fillers, you get that immediate.
which is a great segue into my second candidacy thing. So, number one is, are you a novice? Is this not your first rodeo, right? The second is, are you the kind of person who's looking for immediate gratification, or are you someone who can ride the wave that is multiple sessions with very subtle improvement over time? If the answer is no, I'm here to, like, be given the mirror and instantly feel better. Well, then Sculptra and Radius are not for you, right? The other patients I think of as good candidates for biostimulatory fillers are people who are so hollowed out. in their temple or in that area that when you like suck in your cheek gives you that contour that you would normally bronze or highlight. Bronze, really. That is like a vacant cavity that I find hyaluronic acid really has a tough time filling, and filling naturally maybe is the more appropriate response. Or you could fill it naturally, but the amount you would need would terribly break someone's budget and not be reasonable for a lot of people. So that's a great candidate for biostimulatory fillers. And then the people who are just like, I am too afraid. My anxiety cannot take a dramatic change in my face. And I actually want this like subtle enhancement. Those are going to be patients who are better riding the long, long wave that is the biostimulatory fillers. And someone who wants a long result, I mean, they do last a little bit longer, but I think that the improvements you can get are more subtle. I don't know if you agree. Like to me, subtle doesn't mean the opposite is dramatic. I'm not trying to suggest that hyaluronic equals looking filled, right? I think we belabored that. Like we belabored that topic. But to me, I still always argue that when done well, the confidence boost you can get from HA fillers, because I think the results can be more significant, is greater than what you're ultimately going to get, even if you do 3, 4, whatever sessions of like sculpture or radius.
I think of sculpture as someone who's playing the long game. They're coming in maybe even a little bit before they need it, and they're planning ahead and they're like, I'm going to get one vial on every birthday just to kind of maintain. And then they don't necessarily need that symmetry that an HA filler really would help with the jaw or the lips or under eye. So, yeah, but a lot of times it's kind of working both. But I think of sculpture, I say, is playing the long game. It's trying to collagen bank before you lose significant amounts of it. And then HA is for that balancing, that localized area that needs a little boost.
That's a good way to think of it. Like HA can be more corrective, and you can think of biostimulatory as more preventative. I definitely agree. And it's funny you say that, because the like sculptor sprinkle, as I like to call it, which is my one vial once a year, starting in like your mid 30s, is what I think is like the good candidate, or even your early to mid 30s. That's great. And that's part of my like, what is our preventative aging plan that may include a yearly resurfacing laser or whatever else? I agree totally.
Yeah, I'm going to use that, the sculpture sprinkle.
Ultra sprinkle. It's yeah, I know. I need to copyright that, right?
That's right. Amazing. Well, who's a good candidate for HA fillers?
So I think the good candidate for HA fillers is first and foremost the good candidate for any cosmetic procedure, which is someone who has reasonable expectations, very important, right? And somebody who, which I think we're pretty good, at least in the core aesthetic specialties, at ruling out, which is someone who doesn't have like a facial or a body dysmorphia, right? That's like baseline. So not perseverating on features, and thus, as a piggyback off that, having reasonable expectations for what can and cannot be done with filler. The secondary patient, like who really is a good candidate, is just, again, maybe this goes into reasonable expectations, but be willing to swell, be willing to bruise. Like I always tell people, as skilled as I am at knowing where major vessels are and using cannulas to try and minimize trauma, I cannot promise you you're not going to bruise. So, like, please, for the love of God, do not come to me and be upset that you didn't tell me you had a gala the day after and you have a bruise, right? So, again, like, kind of relatively clear your social calendar. People need to be in generally good health. Like, I don't consider smoking to be an absolute contraindication the way that many surgeons would, but I do find that if you smoke, it will accelerate the metabolism of your filler, and you will be doing it more frequently, and you won't have as long of a last. So that makes you not as good of a candidate. Certainly, people who have any autoimmune condition, like especially of a rheumatologic variety like lupus or scleroderma, we have found that they have a slightly higher risk of inflammatory reactions to the non-HA fillers. So those would be better candidates for HA fillers. And again, people who are looking for that kind of instant boost, who have an understanding that it's going to be able to volumize, but it's not going to be able to lift the degree that some other procedures can. I don't know if you found in your dermatology colleague community, but like there's people who are in the camp of fillers can lift, and then there's people in the camp who fillers cannot. And I think that fillers can lift a little, but I personally don't think fillers can like significantly reposition tissues of the face. Like I don't believe you can fix a jowl by treating the jawline.
You know what I think it does is it tricks your eye, right? It changes where you're looking.
Yeah. But anyway, I'm going off on a tangent here. But all of that to say, like, I don't know, maybe there's other things if I thought I would really add into there. But my biggest things are like, are your expectations reasonable? That's baseline. Make sure you're not perseverating on a feature knowing that my result is not going to be meeting your expectation, right? 3, be willing to have some relative social downtime. That's all just like baseline. And then having the appropriate degree, meaning not severe enough that fillers aren't going to fix the problem of volume loss or wrinkling. Because some people, have wrinkles so deep, I'm like, I need to do an ablative resurfacing laser on you. And there's no way fillers can fix this, right? Like you have perioral lines that are so deep, I'm like, you need like a contour, TRL, erbium, or like a CO2, you know? But anyways, that's who I would say would be good candidates. And people who are novices, people who are starting fresh, unless they're doing the sculptor sprinkle.
That's right. Yeah, it's a great one to start with. Just like a little Botox, a little toxin is a great one to start with. It's not permanent. If you don't like it, it can be dissolved. So those are all great tips. I like what you mentioned about sometimes you just need a laser resurfacing. I find that first and foremost, if you have nice skin, everything else looks better. So someone might come in saying, I need filler under my eyes. And I'm like, you know what? If we just resurface you or do a strong chemical peel, you're going to look amazing. You're not even going to notice that like you do right now. So sometimes rather than doing filler, just getting the complexion more even, more uniform, I think helps tremendously too.
Yeah, and sometimes the issue is actually a skin issue, and the person doesn't realize it's a skin issue that really filler cannot fix. So I agree. Either other modalities end up fixing the problem without filler, or the other modalities are a complement to the filler because you want holistically to look better. You don't want to fix one problem and not fix the other. And I agree. Like issues of elasticity cannot really be fixed. Like if you have horrible chronic sun damage where you have leathery, I mean, no, I'm painting the picture of like an extreme, right? But like you have leathery, deep, crepey skin, one filler is most likely not going to fix the problem. But let's say you do have areas that filler is going to fix, but then we fix those areas. You still have leathery, loss of elasticity, crepey skin that ultimately So the other point I wanted to drive home here is like cosmetic consults should be multifactorial, multimodal, right? Like there's a reason all these things exist. Botox does not do what filler does. Filler does not do what lasers do. So rarely do I say just do one thing because to your point, you want to look your best in every capacity, and that's going to require multiple modalities, filler being maybe only one of them.
Right. Yeah, exactly. Just one piece of the puzzle. So, well, this has been a lot of fun. I've learned a lot. I know the listeners have as well. Hopefully, we have helped people not be afraid of filler, hyaluronic acid filler, that it can be amazing when done correctly. I know people are going to want to find you and follow you. You have a lot of great info on social media. So, where's the best place for people to do that?
Yeah, so the best place to follow me is Instagram. I admittedly have not caved to TikTok yet, much to my followers' dismay who tell me I should do it.
You're waiting to see what happens, right?
Yeah, I don't know. I never downloaded the app on my phone, and for some reason that was like my iron curtain, and I refused to like go into the TikTok space. But anyways, Instagram at derm.dr.rachel. So derm.dr.rachel. That is the best place to find me. I do general but mostly skin and beauty focused and cosmetic treatment focused Q&As every Thursday that have been my kind of, I hate to say claim to fame, but that's really kind of what I think gave me my following. And people find that I give really evidence-based, comprehensive, thought-out answers to really a whole gamut of things. So if you want to find me there and want to learn more, then that would be the place to do so.
Amazing. I love that. We will include all of that in the show notes. And you also practice in New York, right?
Yes. So if you want to find me as a patient and you want to see me, I practice on the Upper East Side of Manhattan, right here in New York City, actually like a stone's throw from my apartment here. You can basically see it from my window. So I practice at Marmur Medical, Marmur, which is named after who I formerly mentioned is my colleague and mentor, Ellen Marmur. So you can find me there. You can call the office directly. There's a way to book an appointment online personally with me. So there's a lot of ways you can get in contact.
Amazing. Well, thank you so much. And this was amazing. And I will see everyone next week.